it's definitely very, very rewarding. You go into, a limb that is, grossly malaligned, or a hip that barely moves. Somebody can't barely get out of a chair, or can't tie their shoes, can't put their socks on, and you go in and make it, you can make a leg straight. You can give a hip range of motion back, and within a matter of time, that all of that function is back. In general, with basically no pain. So just the quality of life difference you can make with the operation, and again, like you said, you visibly, you're looking at it, and it's nice and shiny and metal, and it looks new and it looks good right away. You can kind of tell that the motion is better, the alignment is better. When a patient wakes up, if their leg was pointing the other direction because they had such severe disease, and we wake up even before they move to therapy, say, look at your leg, and their leg is straight. It hadn't been straight in 20, 30 years. So it is definitely very gratifying to because like I said, part of with orthopedics, especially total joints, is here's a problem and it's fixable, and it's relatively immediate. As soon as you're out, obviously there's recovery time for the patient, but as soon as the surgery's done, there's an obvious change and improvement. I think just seeing the difference, when you see patients come in, even to a point where they're in wheelchairs, crutches, barely able to walk, can't even do their daily activities, getting around the house, getting dressed by themselves, and then you haven't seen them for a while. They're back for a follow-up, and it's 3 months later, and they just they drove themselves to the office by themselves. They got no cane, they got no limp, and you don't even recognize them when they go zipping by in the hallway to go get their X-ray, and they're back at work, and they're feeling great, and they have no pain, and it really is gratifying. Somebody who had never seen, not on a walker, not on crutches, or sometimes in a wheelchair, and now they're just walking around, and you can't even tell what they had surgery on, and that makes it's the quality of life difference that you can make for people is really that's what makes it worth it, makes the difference.